Hi, I'm Michael Rowley, the Chief Medical Officer of Blue Star Telehealth. This brief video will introduce you to Blue Star's Remote Patient Monitoring, or RPM program. Remote patient monitoring uses digital technologies to transmit health data from a patient outside of a clinical setting to a healthcare professional. Here's how it works. Cellular or Wi-Fi enabled devices such as blood pressure cuffs, glucometers, spirometers, pulse oximeters, scales, and more measure a patient's physiological parameters. The information is sent to a team of qualified healthcare professionals who reviews the data. The monitors determine whether the measured values warrant further action according to the clinical protocol approved by your institution. When an out-of-range value requires us to contact the patient, we'll ask them to repeat the measurement, ask them if they've taken their medications as directed, and attempt to identify other externalities that may have contributed to the out-of-range parameter. When appropriate, the monitoring team will contact a member of your staff for further instructions or for clinical follow-up. This program will provide you with accurate, actionable data points to inform the medical management of your patients with chronic conditions. You'll know whether your patient has responded to medication changes before your 3 or 6 month follow-up. You'll be able to react to changes in your patient's health before they result in an ED visit or hospitalization. You'll know things like whether the readings you're taking in the office are the result of white coat hypertension or represent an insidious worsening of their blood pressure control. Your patients will become more engaged in the monitoring and management of their chronic conditions. On average, enrolled patients have improved control of their chronic conditions and report a high degree of satisfaction with the program. Best of all, you'll reap all of these benefits and more without having to undertake any additional clinical or administrative burdens. We do all the scut work. You focus on clinical care. I hope this video has helped you understand how remote patient monitoring works and why it's a valuable addition to your clinical telehealth toolkit. If you have any questions about how to enroll your patients, please contact your local RPM program manager. For clinical questions, feel free to contact me directly at michael.rowley@bluestartelehealth.com. We're always looking for ways to improve our service, so don't hesitate to give us feedback on how we can make RPM better for you, your staff, and of course, your patients.